Hi, good morning, everyone. Thanks for joining us today. We hope that you're happy and healthy and well and looking forward to a nice holiday weekend. Today's webinar is being hosted by the Muse, which is Middlesex County's entrepreneurial community. The Muse provides business resources and co-working space for startups, entrepreneurs, and small as well as micro independent businesses that are looking for collaboration, information, and space for growth. This morning, we're happy to welcome Sheila McKinley-Bell of Shoreline HR Consulting. She is here to help walk us through the business concerns that the pandemic has raised for businesses across the state and provide recommendations for the issues and challenges that may arise or are arising for companies and their staff. Just a little side note, we have been having some audio issues, and we will proceed as we can. If it gets too much, we might have to do a recording and then send you the recording. But if you have any questions or having any audio issues on your end, please send us a note through the chat or question and answer panel. Thank you. My name is Rebecca Mead, and I work with the Muse and am moderating today's webinar. And I'm sure that many of you are Zoom experts by now, given our love for the online virtual meeting. But I thought I'd go through a couple of housekeeping tips before we begin. All participants are in listen-only mode. However, we do have the Q&A and chat feature functions enabled, so please feel free to send us notes or ask questions through either one of those, and we'll help you as we can. And we're going to keep the questions till the end and ask Sheila after she's finished with the main body of her presentation. And we are recording today's webinar and have our fingers crossed that the audio stays throughout the entire time. We'll send an email out later today with the slides and the recording once we have that process. So again, if you have any problems seeing or hearing anything today, please reach out through the chat and I'll do my best to assist you. So I think that's about it from my end. So let's get started, Sheila. Thanks so much for being with us today.
Oh, you're welcome. Well, good morning, everyone, and thank you for coming. My name is Sheila McKinley-Bell, and I'm the principal consultant for Shoreline HR Consulting. I have a home office in Clinton, Connecticut, and I work with employers all throughout the state. Today, we will be discussing some key HR considerations regarding COVID-19 in the workplace. My presentation will last about 40 minutes or so, and all right, let's begin. I need to try and advance this one. Okay. All right, the next slide, Rebecca, if you would, is the agenda. And so this is what we're going to talk about today. Primarily, we're going to discuss the three laws that were enacted in March of this year. Two of them are federal laws, the CARES Act and the FFCRA, and then the Connecticut Executive Order. And then we're going to go right into returning employees to work, health and safety issues related to COVID, of course, and managing the remote workforce. And then we'll talk about the resources that are available. Okay, next slide. So as soon as it became apparent, so in March 2020, Congress and the President enacted the CARES Act and the Families First Coronavirus Act, and Governor Lamont in Connecticut issued Executive Order 7H, which I think we're up to 7QQ now with various amendments to that executive order. There were lots of facets to these laws, but for our purposes today, we will be discussing the sections of these laws that created HR considerations and challenges. Also, it's important to note that the information that will be discussed here is mandatory for non-essential businesses. So if you're an essential business, it's understood that you have your own specific guidelines to follow. Therefore, those of you who represent essential businesses can consider the information we're covering today to be best practice.
All right, so as I mentioned in the previous slide, there are three laws that were enacted in March. Two of them are federal laws, and one is an executive order issued by Governor Lamont here in Connecticut. The first law was the CARES Act, which is the Coronavirus Aid, Relief, and Economic Security Act. And what this law provided was $2 trillion in relief to individuals, businesses, and state and local governments. It enhanced benefits to employees and provided relief for certain employers under state unemployment compensation system. And it expanded eligibility for employees and provided tax credits, grants, and loans to businesses. And this particular law is the one that created the Payroll Protection Program and the emergency loans and grants that came through the Small Business Association and the banking system. The next slide covers the Families First Coronavirus Response Act, and this was also enacted in March and became effective April 1st and is supposed to extend until December 31st of this year. And there's no telling at this point if it's actually going to extend beyond that. So what the FFCRA did was it requires private insurance plans to provide free COVID-19 testing, provides increased funding for some state programs, in particular unemployment insurance. And there were two significant HR considerations with this particular law. It expanded the current federal FMLA with an amendment called the Emergency Family Medical Leave Expansion Act, which is known in HR circles as FMLA Plus. And why this is significant is the federal FMLA is a requirement for employers of 50 or more employees. However, this FMLA Plus amendment expands the requirement to employers with less than 500 employees. So now, if you're an employer with 1 to 499 or 500 employees, this particular amendment applies to you. However, it only expands FMLA for one particular qualifying event, and that is that the employee has to stay home to take care of a child under 18 whose school or child care provider was closed because of the COVID-19 emergency. And if that is the case, and the employee has to have worked with you for 30 days, there's no hours requirement, and I won't complicate things about that, but under the regular federal FMLA, you have to work a certain number of hours to be eligible. But for this particular law, you have to only have worked for your employer for 30 days, and you can be full or part-time. And what happens is if an employee wants to use this leave, they are eligible for up to 12 weeks of time off. The first 2 weeks are unpaid. They can use any PTO, or if you're still doing earned time off, they can use their vacation time. And then the final 10 weeks of that 12-week period are paid at 2/3 their regular rate of pay. Part-time employees' pay is based on an average number of hours worked in the last 6 months. And overall, the pay is capped at $200 a day and a $10,000 total. The other significant element of this particular law is it implemented the emergency paid sick leave, which again applies to employers with less than 500 employees. So this means you. And what it provides for is 80 hours of paid sick leave, which can be prorated for part-time employees and can be used in addition to any accrued sick or PTO time. Employers are eligible to receive refundable tax credits to reimburse them for anything that they've paid under this part of the law. And employees are eligible from day one of employment, which is really, frankly, unheard of in HR circles. Usually there's a period of time that the employee has to work for you, but not in this case. And there are 6 specific reasons someone can become eligible for the emergency paid sick leave, and we're going to go into those 6 reasons now. So to the extent the employee is unable to work, there are 6 specific reasons that they can use emergency paid sick leave. And the first 3 are related directly to the employee. Number 1, the employee is subject to federal, state, or local quarantine or isolation order related to COVID-19. 2, the employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. And 3, the employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis. The other 3 reasons have to do with others. Number 4 is the employee is caring for an individual who is subject to quarantine or isolation order or has been advised to self-quarantine by a healthcare provider due to COVID-19. So it's somebody else that they're caring for. Number 5, the employee is caring for a son or daughter if their school or place of care for their son or daughter is closed or the child care provider of such son or daughter is unavailable due to COVID-19 precautions, which is related to the FMLA Plus that we just talked about. And then number 6 is the employee is actually experiencing any other substantially similar condition specified by the Secretary of Health and Human Services in consultation with the Secretary of the Treasury and the Secretary of Labor. And I have connections to those websites so you can actually inform yourselves about all of that. So, once you determine that somebody is eligible for emergency paid sick leave, the benefits are for full-time employees, which are defined as someone who works 40 hours a week, they would receive full pay for the leave due to those first 3 reasons and 2/3 of the pay for the reasons 4 through 6. Part-time employees, their pay would be calculated based on an average 2-week period. And then employees that have worked for you for less than 6 months, their pay is calculated based on regularly scheduled hours. So that brings us on to the 3rd law that was enacted in March that is affecting employers throughout the state. And this is Executive Order. It was initially called Executive Order 7H. And first and foremost, this particular law, first of all, it's a state executive, it's a law. It's a state law that was enacted by our governor. And it outlined a lot of different things. And we're going to be spending probably most of our time talking about this because there's lots of things that that became mandatory. So the first thing that the executive order defined was the difference between essential and non-essential businesses, and then outlined the requirements regarding business closures, in particular for non-essential businesses. And since it was initially enacted, Governor Lamont issued addendums to the executive order that lay out a plan to stagger reopening of non-essential businesses throughout, right now through September 2020. And as I mentioned before, actually, I think we're up to Executive Order 7YY now. I think I said QQ before, but I think it's actually YY, and it could be beyond. And once he hits Z, it might go back and start using the letters 3 times. And in particular, the Department of Economic and Community Development has created sector-specific guidance to assist you with your reopening plans. So overall, the executive order identified guidance and mandates regarding capacity limits, cleaning and disinfection protocols, teleworking, high-risk groups and persons over 65, face masks, social gathering limits, appointing a program administrator, preferably a management level individual or the business owner themselves, to implement and oversee the return to work rules and protocols and to handle complaints. And also required self-certification to reopen or suggest self-certification to reopen. And the link to the DECD self-certification guidelines is included in the resources at the end of the presentation, so you'll get that. But before I continue, I need to have a quick word about plans, policies, protocols, and postings. So OSHA recommends developing an infectious disease preparedness and response plan, and they've issued a publication that outlines what needs to be included in the plan. And I provided the link to that presentation, to that website at the end of the presentation. But generally, the plan needs to include infection prevention measures, policies and procedures for identifying and isolating sick employees, and your communication and training measures. And the Connecticut DECD has developed checklists that will help you with this. So you've got some support there. You're also required to develop a training program for employees to follow this plan, which they should actually be paid for attending. And policies and employee handbooks need to be audited and updated or developed if you don't have them to ensure compliance. And in particular, you want to establish and update policies on attendance, paid time off, telecommuting, time off requests, rules of conduct, leaves of absence, flex time, travel, break time, and technology upgrades and security protocol. And communication of the plan and protocols need to continually be reviewed and refreshed with employees and need to carry a strong and frequent message. Also make sure the most current mandatory postings are visible as well, and that you also have clear signage reinforcing the new policies on social distancing, cleaning and disinfecting, PPE protocols, and reporting symptoms. This is an opportunity for you to step back and lay out a comprehensive approach to ensuring the safety of your employees and customer clients. And those of you that are already open, if you haven't done this, basically you can just document what it is that you're doing, because I'm sure you're complying. You just haven't actually created a document that summarizes all of it. And the requirements about postings are that they be visible, in a conspicuous location, readable, not defaced, and posted where employees report to work each day. And the posting requirements still apply for remote workers. In this case, you can utilize the internal website link that you have and ensure that they are conspicuously displayed and employees are notified on how to access those postings. And just a quick quote from the EEOC: employers are encouraged to post the electronic notice on their internal websites in a conspicuous location. In most cases, electronic posting supplements physical posting, but does not itself fulfill the employer's basic obligation to physically post the required information in its workplaces. In some situations, it may be required in addition to physical posting. For example, for employees who telework and who do not visit the employer's workplace on a regular basis. So we're going to talk about return.
One quick thing, just if you could just let me know when if there's a new slide. So I just want to make sure I'm staying up with it.
All right, so I'm
Thanks.
on slide 12, returning employees to work.
Okay.
So as employers, you have an obligation to provide both safe work and a safe workplace, which now includes taking steps to keep COVID-19 out of your workplace. And one thing you have to make sure you remember and remind yourself frequently is that employers are going to be fearful about returning to work, even if they've returned to work already. There's still a lot of fear out there. So you as business owners need to be committed to providing a clean, healthy, safe, and secure work environment for all your employees and your customers, of course. And this includes making sure that no one enters your workplace if they have or may have the disease. To achieve this, you'll need to take some or all of the following actions as employees return to your work site. So perform employee screening before entry, monitor employee health status while at work, enable contact tracing of exposed employees, follow social distancing guidelines, provide for workplace sanitation, require proper hand washing, and require and provide appropriate personal protective equipment, and also respond to a COVID-19 situation swiftly and safely and follow pertinent leave laws. Also, I have an update here. About a week ago, the Equal Employment Opportunity Commission, EEOC, has issued new guidance stating that employers cannot require employees to undergo antibody or serology testing to determine whether the employees were previously infected with COVID-19 or are otherwise immune to the virus. They're basically concluding that antibody testing is a medical examination and is in violation of the Americans with Disabilities Act because it is not, quote, job-related and consistent with business necessity. So just be aware of that if that's something that you've thought of doing. Next slide. So if an employee is unable or unwilling to return to work, the first, you have to kind of go through this process of making sure that other things don't apply before you get right down to they're just flat out refusing to return to work. So the first thing is find out if the reason they don't want to return to work is related to childcare concerns related to COVID-19 and determine whether or not they're eligible for the 12 weeks under the FMLA plus. Then if you are an employer with more than 50 employees, do they have a bona fide serious health condition and are therefore eligible for the federal FMLA and the CT FMLA? And then do they meet any of the 6 eligibility criteria for emergency paid sick leave? Are they sick? Are they immunocompromised? Do they need to care for an at-risk individual? And if they've been teleworking, can you allow them to continue to do that without creating any undue hardship on the operation? So those are all the things that you need to consider. But if you've answered all those questions and they're just not eligible for any of that, and they don't meet any of that criteria and they're still refusing to return to work, if they refuse to return to work, bottom line is you can accept their resignation. I mean, it's that simple. And you can let them know that. So, as long as you've kind of jumped through all those other hoops and checked, dotted your I's and crossed your T's about their eligibility for other things, if it comes right down to it that they don't qualify for any of those other possibilities, then you can simply accept their resignation. Next slide. Now we need to talk about the health and safety considerations, and they're extensive. There are 7 health and safety considerations, and we're going to talk about all of them. The first 4 are screening and monitoring employees, wearing face masks, establishing social distancing, and following the CDC guidance on contact tracing. Regarding screening and monitoring of employees, in the state of Connecticut, employers are mandated via the executive order to screen employees and customers before they enter the building. The screening can include both a brief questionnaire and an external temperature check. If using the questionnaire, it should be handled by a manager because the information is considered confidential and would be filed in the employee's record. Many employers are opting to use external temperature scanners or thermometers. The optimal external temperature is less than 100.4 degrees. If it's 100.4 or above, then they can't work. But if it's below 100.4, then they can. Accuracy and consistency is important, and all employees should be scanned. You just can't, select who to scan and who not to scan. It's definitely equal opportunity there. Everybody needs to be scanned if you're going to use that method. You can also ask employees to take their own temperature and provide an attestation that they do not have a fever. Employees who develop symptoms while at work are expected to come forward. Employees may be asked health-related questions and have their temperature taken. Employees who are found to have COVID-19 symptoms as defined by the CDC should be isolated from the rest of the workforce and sent home. And I suggest drafting a policy on this process that employees are required to read and sign off. Please note that under the ADA, employees' medical information must be kept confidential and maintained separately from the employee's general personnel file. This means that you should not disclose to the entire workforce which employee has an elevated temperature, tested positive for COVID-19, or was exposed. Wearing face masks. You can require employees to wear face coverings while at work, either all the time or in specific circumstances. If an employee has their own office, they can remove their mask while alone, but should wear their mask when interacting with others in the workplace. Depending on an employee's exposure to COVID-19, face masks may include cloth coverings, surgical masks, or N95 respirators. Your policy should remind employees to be careful not to touch their eyes, nose, or mouth when removing their face coverings and wash their hands or use hand sanitizer immediately after removing their mask. Masks should completely cover the nose and mouth unless doing so would be contrary to the employee's health or safety due to medical conditions. And let's talk about that for a minute. If an employee states they have a medical condition that prevents them from wearing a mask, you cannot ask them for a note from their healthcare provider. However, you can ask them to provide you with written attestation that they have a medical condition that prevents them from wearing a mask. They don't have to disclose what the condition is, and as I said, they don't have to provide you with a note from their healthcare provider, but you can ask them to put in writing a written attestation that they have a medical condition that prevents them from wearing the mask, which should, of course, be in their file. And to avoid having a number of employees follow suit, you should remind all employees of your policy about lying as a terminable offense, because, you know, once one person finds out that they don't need a note from their physician, so, you know, to basically say that they have a medical condition and they can't wear a mask, and it's that simple, others might follow suit. And if you want to avoid that, I strongly suggest that you remind people that if it turns out that you find out that someone's lying, that they could be fired for doing that. It's abusing the law. Establishing social distancing. There are a lot of ways for you to create a distance within the workplace, often at no extra cost. There's been apps that have been developed to track the distance from others and to alert the individual if there's a 6-foot distance breach. Some of these apps capture information about the other employees to help with contact tracing. Other options include flexing work hours, video conferencing like Zoom, allowing employees to work at home, establishing one-directional hallways or aisles like they've been doing in the grocery stores, and using visual cues that are easily understood by all languages. You can set limits on group numbers and duration of gatherings, such as in conference rooms, lunchrooms, and on-site fitness centers. And you can stagger breaks or meal periods to help minimize the number of people within a designated area. Common areas where employees congregate can be closed or expanded to allow for greater distances. Open office arrangements can be adjusted to allow for more space between workstations. In the case of elevators, encourage the use of stairs, create passenger limits, and visual social distancing markers. And some buildings are assigning actually an elevator attendant, if they can do that. Where possible, designate a person of authority like a manager, supervisor, or shift supervisor to be responsible for determining proper social distancing standards. This person would be responsible for monitoring social distancing at work and address any concerns or issues with employees who do not comply, whether willfully or unknowingly. And to reduce the spread of germs, the designated person may also set limits and restrictions on non-essential work-related activities like shared treats, company picnics, social gatherings, potlucks, celebrations. So additionally, you should encourage employees to follow all public health guidelines while they're off work. I mean, you can't control everything, but you can remind them that it would keep their workplace safe if they continue to follow the guidelines when they're not working. And the fourth health and safety consideration is the CDC guidance on contact tracing. And so as part of the response to an employee being exposed, having symptoms, or testing positive, you can ask the employee the names of other coworkers with which they had close contact. Those employees should be notified of the potential exposure. There are digital contact tracing tools available that can help collection efforts. Some allow for electronic self-reporting and can use location data to identify contacts who might otherwise be unknown. Other tools might use employee cell phones to identify when they got within 6 feet of each other, but employees would need to have their phones with them. And if that's not something that you allow in your workplace, then that would not be an option. And then there's apps that will even anonymously contact anyone with which an employee breached the 6-foot distance for a period of time. Next slide, please.
Sheila, can I just interrupt for 1 second? We had a couple questions all related to the face masks, so I'd like to see if we could address those now. Is that okay?
Okay.
Sure. All right.
Sure.
So The first question was, what if an employee has a belief that face masks are dangerous to their health, even though they don't have a medical condition?
Well, so but they're only protected from not having to wear a mask if they state that they have a medical condition. But if they don't tell you that, then really it could be considered, I know this is going to sound terrible and very direct, but it could be considered insubordination. I mean, we're trying to follow rules around during a pandemic, during unprecedented times, and you're not actually going to tell the person that. You can simply say, are you telling me that you can't wear the mask because you have a medical condition? And if they say no, then you can say, then you must wear the mask, if that's what your company is requiring. So that's really the bottom line. If they say they have a medical condition, you can, I strongly suggest that you say, okay, put that in writing so we can put it in your file and you don't have to wear a mask. Really, that's simple.
Mm-hmm.
So,
thank you. So as a follow-up, another participant asked, in regards to a condition where they can't wear a mask, they may have, a legitimate medical condition. How do we lawfully handle that with other employees who will see this and with clients that may be concerned?
Right. Well, okay. So first of all, that's why I said it's good to get an attestation, because you can't ask them for a note from their healthcare provider. They can just simply state they have a medical condition and they can't wear the mask. So, and you can say, okay, you don't have to wear the mask. However, there is an issue when it comes to your clients, and that's where you might have to get creative. Either that person has to be somewhere where they're not having access to the clients, maybe that you need to have them work remotely. You'd have to figure out some creative way to allow them to continue to work and not expose your clients to potential exposure to COVID-19. As far as employees go, that's why I said before that everybody who says that they cannot wear a mask because of a medical condition really should be putting it in writing. And then you need to emphasize with people in general, not point out anyone in particular, but just simply say, remember that lying at work is a terminable offense. So people know it's intended to be a veiled or maybe not veiled threat, a reminder to employees that they need to tell the truth. And if they lie and they put other people in danger because they lie, that is definitely a terminable offense. So, you're not going to be able, it's not going to be foolproof. You can't necessarily account for all of it, but that's one thing that you can do to avoid a number of people lining up outside your office saying that they can't wear their mask because they have a medical condition.
Okay, we have a couple more follow-ups to that that are specific to a type of business, and I think maybe best for a conversation offline between you and this participant, if that's okay with you.
Sure.
Yeah. It did say that, to follow up on that first question I asked about, the belief that the face masks are dangerous, even if they don't have a medical condition. They said that they don't feel that they are lying, but have firm beliefs that wearing a mask will cause a medical condition and cause them to catch COVID.
Well, I'll tell you that, everything points to the north, which is the CDC. So, before you act as an employer, if I were you, I would go directly to the CDC website and read up on the face masks so you can provide your employee with the facts. And you are not the only one that's going to be following CDC guidelines. Governor Lamont has been following it. The rest of the country has been looking at CDC. So it's not like you're making it up, and there's got to be some standard that's out there. And if the CDC has specific guidance about it, whether to wear, cloth masks versus paper masks versus the N95 respirators. Those are the kind of standards that people need to follow. So unless the person can provide you with some bona fide information that supports their theory that wearing the masks would actually create exposure to COVID-19, you know, I would check that out with the CDC first. I mean, unless they come forward, and I can't think of any other place other than the CDC, quite honestly, that I would rely on for any information about face masks. But, you know, if you want to engage the employee in the conversation, then ask them to produce the information that gave them that caused them to create that belief. Sometimes you have to go there with people to finally bring them back to center.
Okay. So I'll make sure that the participants get your contact information following this. And I know that you have a set of links at the end of the presentation directly to the CDC.
Definitely.
Yep. Great.
Absolutely.
Thank you.
Yeah, you're welcome. Okay, so we're going to go to slide 15 and continue with the health and safety considerations. And the last 3 of the 7, which are responding to an incident, sanitizing the workplace, and record keeping. Responding to an incident, no matter how you learn an employee has or may have COVID-19, you'll need to respond quickly and appropriately. The CDC indicates that if you learn of an employee's exposure, you should not let that employee enter the workplace. If the employee is already on site, you are to separate the employee and send him or her home. If there's any critical staff that may be allowed to continue working following a potential exposure to COVID-19 and they are asymptomatic, and additional precautions are implemented, they can stay in the workplace, but they must be informed that they've been exposed. An employee who had an exposure that remains asymptomatic should adhere to the following practices prior to and during a shift. Measure the employee's temperature and assess symptoms prior to work. Ideally, the temperature check should happen before the individual enters the facility. And then while they're at work, as long as they don't have a temperature or symptoms, he or she should self-monitor under the supervision of their own physician. Employees should wear a face mask at all times while in the workplace for 14 days after the last exposure. The employee should maintain a 6-foot distance and practice social distancing as work duty permits. And clean and disinfect all areas such as offices, bathrooms, common areas, and shared electronic equipment routinely. So if an employee becomes sick during the day, he or she should be sent home immediately. Surfaces in the workspace should be cleaned and disinfected. Information on persons who had contact with the ill employee up to 2 days prior to symptoms should be compiled. Others at the workplace who came within 6 feet of the ill employee should be considered exposed. Employees who have COVID-19 symptoms should notify their supervisor and stay home and follow CDC recommended steps. Employees should not return to work until the criteria to discontinue home isolation are met in consultation with their healthcare provider. If an employee reports that a coworker looks ill, investigate immediately and determine your next steps. If the coworker appears to have symptoms or reports symptoms, the coworker should be isolated and sent home. Employees who are well but who have a sick family member at home with COVID-19 should notify their supervisor and follow the CDC recommended precautions. Sanitizing the workplace. If an employee is at work and complains of feeling ill, immediately isolate them and send him or her home. Then determine where the employee was so the work areas can be cleaned and disinfected. This means that all items and surfaces that the employee could have come into contact needs to be addressed. Examples of frequently touched surfaces and objects that may be contaminated include machinery and equipment, tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets and sinks, and touch screens. And if the ill employee was coughing excessively, that must be taken into consideration because droplets can travel and land on surfaces up to 6 feet away. Items or surfaces that have visible dirt on them need to be cleaned with soap and water before being disinfected. And hand sanitizer must be made available at entrance points and common areas, and employees should be encouraged to use it frequently. Record keeping. If an employee contracts COVID-19 at work, it must be treated as a work-related incident and recorded as such. An injury or illness is recordable on your OSHA 300 log, and this is for employers of 10 or more employees. And it needs to be recorded on the OSHA 300 log if it meets 3 of the following conditions. It is work-related according to OSHA's definition in Code 29 of the Federal Regulations. It is new according to the definition, and it meets 1 or more of the general recording criteria, and I have provided you with a link so you can look at all of that information. According to OSHA, a case is work-related if an event or exposure in the work environment either caused or contributed to the resulting condition or significantly aggravated a pre-existing injury or illness. Basically, if an injury or illness happened at work or while the employee was doing work for you, the case will be work-related. And while we're on the subject, I'd like to mention that currently, Connecticut workers' compensation does not cover COVID-19 claims. But it's important to note that California is considering something called a rebuttal presumption claim. Why is that significant? It's significant because of all the states in the union, California is considered the most, has the most laws that protect employees' rights and in the workplace. And typically, when there's a change in employment law in California, it's not too long after that Massachusetts and Connecticut follow suit. Those 3 states, Connecticut, Massachusetts, and California, have the most employment laws that protect employees in the workplace. So I can tell you, all HR professionals and employment attorneys are always keeping an eye on California. So right now, workers' comp isn't covered, but that could change. Let's go to 2 more slides to 17 and I want to talk a little bit about remote workers. So as you know, there's 3 types of workers. There's on-site, mixed, and remote workers. And you need to determine as the employer what is going to work best for you and your customers and clients. So remote work has been increasing over the years, starting with the work-life balance movement back in the 90s. And in fact, between 2014 and 2017, that's the latest statistic I could find, between 2014 and 2017, there was a 23% increase in employer conversion to a remote workforce. And it remains to be seen following this pandemic, what is actually going to, how much more it's going to increase. So we certainly, as HR professionals, expect the percentage to increase following this crisis. There's also a growing consensus that remote workers are more productive than when they have to commute to a workplace. So the important HR considerations regarding managing a remote workforce are recruiting, interviewing, and hiring remotely, onboarding from afar, providing support to your remote workforce, leadership and communication, and of course, posting requirements for remote workers, which we addressed a little bit earlier. Next slide. So some considerations for recruiting and hiring remote employees are becoming more agile and adaptive to the change, increasing your pool of candidates, which has been a big advantage to some employers. In fact, in one networking group that I belong to, there was an employer here in Connecticut who actually hired a remote employee in South Dakota. And, the employer's thrilled. They're doing quite well. So they never would have considered that candidate if they needed to bring the person on site. You also need to be willing to try new methodologies and learn what works and doesn't work for your business, which includes whether or not, and if you use competency tests, Are they going to be relevant anymore? Modifying your interview process. You know, if you weren't used to using Skype or, you know, interviewing candidates online, well, now's the time. And I can't imagine any business now that hasn't been using Zoom in one form or another. It's just become, it's taken off like wildfire. And then become accustomed to video interviewing candidates. Onboarding, you should be looking at creating a virtual onboarding program utilizing a mix of live, key personnel, and short onboarding videos. Create training videos for various aspects of your program and throughout the onboarding period, which is typically considered the employee's first 90 days. And then there's always breakout groups during virtual meetings. So there's lots of different ways that you can modify your onboarding program and you know, work online rather than face-to-face. Next slide. Supporting a remote workforce. So collaboration and communication is critical, particularly now. So it's important to establish and maintain regular lines of communication, such as general staff meetings, team meetings, and one-on-one meetings. Avoid isolating your remote workers, answer calls promptly, and encourage your coworkers to collaborate with each other without the need for a manager or a business owner. And send encouraging emails and be complimentary of your staff. And when you receive concerns, be sure to pause, then react with empathy and kindness. Again, reminding you, you know, people are very nervous out there and they may not be expressing it to you overtly, but there's still a lot of fear. Encourage people to get up and move around every 30 minutes, stretch, and take a short walk. I want to talk a little bit more about leadership and communication. So leadership level visibility, we're on slide 21, by the way, Rebecca. Leadership level visibility, transparency, and communication will impact employees' trust and performance. But 70% of an employee's engagement in their work is driven by their manager. So you should be scheduling recurring meetings so people can plan and organize, create predictability during this time of uncertainty, and key in on keeping your remote employees unified and give serious thought to frequency and how you will maintain communication. Schedule frequent check-ins and leave space to discuss personal situations. Meet employees where they are, not where you think they should be. Put yourself in your employee's shoes and humanize your communications at every opportunity. Also, reset expectations on productivity and encourage your team to set boundaries and build in buffer time, and make sure you're focusing on the right metrics in this new way of doing business. And really remember, in the absence of information, people make things up. So be sure to over-communicate and fill those gaps so people are always hearing what you're saying and not just making up stories or going on the internet and talking about things that may not be true. And find ways to continue to celebrate victories. We're on slide 22. Replace the water cooler with Zoom meetings, take an interest in what people are binge watching or where the best takeout places are, and encourage contests and creativity. So we're nearing the end. So what's next? Is there going to be an expansion to the FFCRA, meaning the FMLA plus, or the paid leave? What's happening around the country and the economy? Will there be further orders to shelter in place if we take a slide back? Will there be further quarantine orders or isolation orders? You know, none of us really know. I've been really focused on the ct.gov website to keep my finger on the pulse here in Connecticut. So the next slide is my disclaimer. The bottom line is the rules are constantly changing for employers during this critical time. It's important for us all to keep ourselves informed about the changes, at least on a weekly basis, if not daily. Throughout this presentation, I tried to provide the latest information, including a list of online resources for you to access for the most up-to-date information. Probably the most informative sources for business owners are the CDC, OSHA, the EPA, and the ct.gov websites. I'd also like to acknowledge the employment law offices of Bertram, Moses, and Milford, Martha Kalina in Hartford, as well as the Society of Human Resources Management, J.J. Keller, and the CT.gov website. They have been invaluable resources for me while preparing this presentation. And then the next 3 slides are 3 slides of resources that you can access to keep yourself informed. And we're going to open it up for more questions and concerns and comments. And then here's my contact information if you would like to speak to me offline about anything going on with your business. Thank you for having me.
Okay, so there's a lot of, there was a lot of conversation we had earlier about the masks and everything that surrounds that. But one question came in talking about, when an incident happens, and some of the symptoms tracking and all the responsibilities there. And so the question is, does that include symptoms of any kind that you need to respond to, or only the ones that are COVID related?
I would say COVID related. This is all related to COVID. So whatever the symptoms are that are listed on the CDC website, those are the symptoms that you're listening for.
Okay.
And that you're observing for.
Sorry about that. Great. So, we did handle most of the questions around the mask at the beginning. I asked the participants if there are any additional questions you have at this time. Obviously, please feel free to reach out to Sheila on specific employment issues, types of employees or employment and all. But I don't see anything at this point, anything new that's coming up. Wait a minute. I lied.
I just noticed that on my slide that's up front, I don't have my email address, which is Sheila@shorelinehr.com.
And I'll include that in the information we send out later this afternoon too.
Okay.
One question did come in, how do you handle it when employees or clients say it's a cold, but you suspect it and it resembles COVID?
I would err on the side of thinking it might be COVID. I mean, I wouldn't really mess around, especially if you have a lot of employees, if you have customers coming in. If you believe that the symptoms are related to COVID, then I would isolate and have them go home and quarantine for 14 days, unless they can produce something from their healthcare provider that shows that, it's a common cold. But, you really need to protect everybody else, including yourself. So if there's any doubt, I would err on this. My advice is conservative. I would assume the worst and hope for the best and have their healthcare provider check them out.
Okay, thank you. On that note, I think we'll conclude for today. Again, thank you for your patience during our audio issues. I'll edit the recording and get that sent out to you this afternoon so that you can listen again and or share it with colleagues and include Sheila's information in there so that if you do have specific questions, you can reach out. So thank you, Sheila. This was, there's a lot of information to digest, and I appreciate you sharing that with us and breaking it down into kind of digestible portions because, and it's an ever evolving situation. So, thank you
for having me.
Yeah, I appreciate it. Take good care, everyone. Stay healthy and wear your masks.
Okay. Bye.
Take care. Bye-bye.